Welcome everyone to another wonderful episode here at Jaws Podiatry Case Presentation. We're about to embark on another case, a young patient from out of town. This is a great case for a lot of great reasons. Today we're going to go ahead and let me get a glove here. Today we're going to go ahead and perform multiple procedures. Let me just try this out a little bit. There we go. So what we're going to go ahead and do, bunion, correction of the quote-unquote crooked toe, toe shortening 2 and 3, removal of unsightly corn. If anyone is wondering what's all this, this is anesthesia, local anesthesia. We just infiltrated the area again. The patient is non-weight bearing now. If the patient, does stand up, the toe is, as you guys can see, it's crooked. So we're gonna straighten the toe, shorten number 2, shorten number 3, and of course, removal of the unsightly corn. We're gonna put a hold to this video, and at the end, we're gonna go ahead and just give you guys the final outcome. Stand by.
A few moments later.
I think the patient is purely, overwhelmed. And before Dr. Nunez presents this case, we're not gonna film the patient, but we just uncovered, we did the unveiling, right? Tell us how you're currently feeling right now after everything.
I'm so happy. I'm speechless. The results, they're amazing.
So you've been battling, just to tell the world, long toes, unsightly corns, the bunion, your feet. You were embarrassed to show the world your feet.
I haven't worn sandals in years, in like maybe 7 years. I haven't worn sandals, and now I can finally just be confident and just wear whatever I want.
So those tears were not sadness, right? Of sadness, they were tears of joy.
Yes.
It's very liberating, I suspect. So without further ado, before again, and I just want to remind everyone, Dr. Nunez, he's like I said before, orthopedic surgeon, trained in Mexico. He still practices in Colombia, with his, expertise in lower extremity, minimally invasive foot and ankle anesthetic surgery. Truly remarkable. I mean, you talk about magic and a magician. I mean, that is a true definition. So, without further ado, Dr. Nunez, take it away.
Yeah, I've been practicing minimally invasive foot surgery and ankle surgery since many years. I was trained by the pioneers in the technique. One of my closer mentor is Dr. Stephen Isham from Coeur d'Alene, Idaho. And then I joined his practice over 13 years ago. And then he was definitely, and still, my main mentor. In this case, we use minimally invasive technique, and then a lovely lady, 27, really young, but she was complaining about one exostosis right here. Also, this is bilaterally. The hallux was laterally deviated. She had a callus right here, and the second and third toes were long. So the procedure was bilaterally. We shave this. You can see that it's already gone. We make a small osteotomy here, so the toe will be straight. And definitely we short the second and third toes, looking for this beautiful rainbow here. And we remove part of the callus on top of the IPJ. Like you already hear the patient speaking, she's really happy. What you see here, just in case, is inflammation and part of the local anesthetic we use. Yeah, this is pretty much the description of the case.
So Dr. Nunez, let me ask you a question. Where are the screws? Where are the pins? Where are they?
Well, this is the minimally invasive technique. You can see small incisions. One incision there, one here, one stitch. There is no hardware inside, no pins, no screws, no plates, nothing. This is a patient, even though it's bilaterally, she's gonna walk right after. So we're just making this video, but she's ready to walk and be happy. She's really happy. We are even more happy than her. Patients happy, doctors are happy too.
They say, you know, happy patient, happy doctor, happy foot, happy toes. You know, in closing, obviously I'd like to take this opportunity to thank the patient for allowing us to film this. Obviously, I'd like to take the opportunity to thank, as always, you know, an incredible, you know, genuine addition to to pursuing, you know, what we continue to do, Dr. Nunez, myself, to continue to educate and, you know, the entire world that these techniques do exist. Absolutely. As always, thank you for watching.